this morning, and Paul has graciously offered to sit in. This is my understanding, Paul.
Yes,
So
ma'am.
thank you for being here, and he's going to take some notes on Susan's behalf. So we really appreciate that. And generic host, are we recording today?
Yes, it was listed to be recorded. I could start it
Okay.
when you're ready.
Yes, I think if we're ready to start, we'll call the meeting to order if you want to go ahead and start recording.
All right.
So good morning, everyone. We have a pretty full agenda this morning and want to go ahead and get started. Susan is unable to be with us, so we're gonna muddle through this and hope we don't run into any technical glitches, but we do have someone from IT who can help us out. I'm going to go ahead and get started with a roll call. Carol Rodriguez here. Wayne.
Present.
Elizabeth
Here.
DeLaPruz. Sharon Mitchell.
Present.
Dan Rosenthal.
Here.
Lisa Hotley. Wilma Smith. Mike Nickel. And Lillian Eunice. So those four members are unable to be with us. Lillian, I didn't hear from, so she may be joining us a little bit later. Lisa said she would try and get on toward the end of the meeting. I think everyone is aware that we're in the throes of Medicare re-enrollment, and this is Wilma's wheelhouse. So she said she'll be working a 15-hour day today and needs to be excused. And Mike's wife had a fall and is in the hospital, so he was unable to be with us as well. So
Carol?
we'll miss them.
Lisa Knoll is here. She was not, I don't think you called her name.
Oh, sorry, Lisa. Lisa Knoll is here, and I apologize.
Thanks, Liz.
My oversight. Thank you. Thank you, Liz. So why don't we launch right in? I do want to start by saying on the agenda, it has come to my attention that the last few meetings we have gone way over with our allocation of time because we are a chatty bunch and we have lots of wisdom to impart to important topics. But I am going to try and be a little bit better with time allocation. I started out by putting times on the agenda, but was told that if I put times on the agenda, it would be a voting item because it would turn into a timed meeting. And I decided I really didn't want a timed meeting. So, I will try and be a little bit more judicious about time allocation. But we want to get right started. We are just honored to have Gina Travers with us today from the Department of Public Health. And Gina is the Associate Director, and please correct me if I get this wrong, with Health Promotion and Public Health Research. And she is going to talk to us this morning. We've asked for a presentation and then time for some Q&A afterwards for about a 30-minute period. She's going to talk to us about specifically older adult services. I know we wanted to also talk a little bit about vaccines and kind of the work of public health with the county. So Gina, I'm going to turn it over to you.
Okay, well, thank you. Thank you very much. I'm honored to be here today. I do want to manage some expectations because that is not what I was asked to present on, actually. I'm going to be talking about our community health improvement plan and sort of how that came about. It's a regional effort, and we'll touch on the 5 priority areas that were identified through our assessment process. But if you are wanting information on those services, happy to come back and present on that as well at another time. So I'm going to go ahead and pull up my PowerPoint. Let's see here, just a moment, everyone.
And Gina,
Okay,
that's terrific.
can everyone see this? The PowerPoint?
No.
No? Oh dear. Okay, hold on.
There's a share button. Do we need to share the screen with her? or-
Oh, yes, yes. I'm sorry. It's been a while since I used Zoom. I'm used to the county's Avaya. It's been a bit.
is-
Let's
This
see.
is even
I
worse than
need to
Zoom. It's
share.
This is
Hold on.
WebEx.
Oh, this is WebEx. Okay,
Yeah,
hang on.
generic
just a
host.
minute.
Can you,
You've been
I
made the
think-
presenter. There should be a share button on the bottom of your screen next to where you mute yourself. And if
got
you
it?
I've
click
I
that,
got that. And then let's see. Hang on just a moment.
Yep.
Now can you all see?
Yes.
Yes, ma'am.
All right. Fantastic. Okay. So I'm going to be talking today about our regional effort around assessing the health of the region and then the plan that is developed out of that. So the group that works on this is the St. Louis Partnership for a Healthy Community. It includes a diverse team of public health leadership from both the city and county. And then it represents numerous sectors, from the health sector to the social service sector to our hospital partners, from law enforcement, parks. We reach out to multiple sectors as we build our partnership. This group also has a 25-member advisory board, also representing various sectors throughout the region, and we have about 65 community stakeholders that are part of this effort. And it is led by the city and county health departments. So we call it the CHA, which is the Community Health Assessment, and then the CHIP. And this process is undertaken by the St. Louis Partnership for a Community, and we stay grounded in the vision that St. Louis is an equitable community achieving optimal health for all. So the purpose of the CHA is to determine the health status of the residents in our region and to understand the factors that contribute to health issues, to identify areas of health improvement, and establish what assets and resources can be mobilized to address the health of those populations. The partnership began working on this cycle. The partnership was actually formed in 2018. This is actually our second cycle of assessment and planning that we have done. We began this planning at the end of 2021, and we use a planning model. We use a planning model called Mobilizing for Action Through Planning and Partnerships, or MAP. And that framework was developed by the National Association of County and City Health Officials, or NACHO. And so that assessment process is comprised of 4 qualitative and quantitative assessments. And I'll go through each of those as we go along. And so the first one of those is the Community Health Status Assessment. And the Community Health Status Assessment analyzes quantitative population health data from both primary and secondary sources in the region to identify important health issues and disparities across age, gender, race, and population subgroups in our region. The findings from the assessment then help us to develop our community health improvement plan. And so quantitative data on these populations and demographics are also around the social determinants of health, access to and linkages to care, environmental health conditions, chronic disease, COVID-19, communicable disease, intentional and unintentional injuries, behavioral health, maternal child health, and family health. The next assessment in this 4 assessment process is the forces of change. This is really like kind of a SWOT analysis for the region. It looks at those social, political, and economic forces that can influence the region's public health system. A wide array of local, state, and national forces were identified through this process as key influencers on the quality of life and health outcomes of our community and local public health system. Some of those major factors that we identified throughout our process were violent crime, citizen advocacy, structural racism and health inequities, housing conditions, underfunded public health infrastructure, and policy changes. The next assessment is the local public health system assessment. And this really measures the capacity of the St. Louis Regional Public Health System around providing the 10 essential services of public health. This assessment identified strengths and weaknesses within the public health system. So it's kind of all of us assessing ourselves on how well we're delivering those services. The finding from the assessment identified many areas of opportunity critical to improving our regional public health system, including the need to improve data sharing, increase community engagement, resolve workforce issues and funding, take an inventory of policy issues, strengthen local partners, and ensure that a strong system is in place for providing the 10 essential services. The last assessment in the process is the community themes and strengths. And this one really captures that resident voice. So this is that community engagement piece. It asks residents their perceptions on quality of life, strengths and assets of the region, regional collaborations. They talked about the built environment and governance. This was conducted through focus groups. We held 7 different focus groups. And some of the categories that they focused on were accessibility, affordability, and acceptability. And some of the main themes that came out of that were access to policymakers, the built environment, the high cost of healthcare and copays, the income disparities, being able to access social benefits, mental health and substance abuse services, racism, discrimination, and the stigma of this, and then lack of support for vulnerable populations. So once we had finished with all of our assessments, we compiled all of this data, shared it with our community partners and steering committees, and then went through a prioritization process where we identified 5 priority areas that would build our community health improvement plan. This plan is a 5-year plan that is worked on with those 65 different stakeholders that I talked about at the beginning. The areas that were identified were behavioral health, the intersection of health and economic mobility, maternal and child health, violence prevention, and behavioral health. And then we had cross-cutting themes that run through all of these priority areas of racism and equity, access to systems and physical accessibility, interventions across the lifespan, participatory and community-driven approaches, and then ensuring that these were trauma-informed. So I just kind of wanted to go through a little bit of the data that kind of surrounded the selection of these priority areas. So the intersection of health and economic mobility. So we see that in this, in the first figure, and I know these are a little difficult to see on the slide, but in the first figure, we see that Black residents are 2 times as likely as white residents to be unemployed in the city, in St. Louis County. And I'm just gonna, this shows both county and city data. And for the purpose of this presentation, I'm just gonna focus on the county data. In figure 20, we see around the cost burden of rentals, that in St. Louis County, only 11.8% of renters were rent burdened, with 20% of those being Black renters and only 9% white. And then the percent of home ownership by race, we see that in the county, 63% of white residents own their home compared to 48% of Black residents. Around maternal and child health, Black infants were about 3 times as likely to die during the first year of life than white residents in both city and county. We see that the percentage of women receiving prenatal care in the inner north region of St. Louis County is the lowest. And there were 5 zip codes identified that where we really want to focus on increasing that prenatal care. Violence prevention. So 2 issues really emerged around violence prevention, namely gun safety and child mortality due to firearm related incidents, homicide and suicide. And so we know that disparities in violence disproportionately affect Black children, youth, adults, men, and residents living in the northern area of St. Louis County. The next emerged around chronic disease, and this was really in relation to the environment around diabetes, heart disease, and the disparities of chronic disease. When we were looking at what is required around making an impact on diabetes and chronic disease, we recognize that lifestyle changes such as eating a healthy diet, avoiding smoking, engaging in regular physical activity, and managing stress really help reduce the likelihood of further disease and also help with quality of life. We also recognize that, you know, it's really easy to tell people these are the things that you need to do, but if they don't have access to those resources, like healthy food, it makes it difficult for them to be able to make those changes. So around chronic disease, we are taking an intentional focus on food insecurity, and in even a bigger step, not just food insecurity, but nutrition security, because we recognize that often when food resources are available, it's not necessarily the food that a diabetic or someone with heart disease should be eating. They tend to be high in sugar, high in salt. And so we want to really focus on nutritious food. And then lastly, we have a focus on behavioral health. 2 primary issues emerged with this around mental health and substance abuse. In both the city and county, overdose mortality increased between 2016 and 2020, with the highest mortality rate for each jurisdiction occurring in 2020. And so we saw really high overdose rates in 2020. The region saw a 45.8% increase in overdose mortality. Opioid-related deaths accounted for the bulk of overdose mortality in the region. So, and we know that overdose mortality rates were the highest for residents in selected zip codes in both North City, North County, as well as South City and South County. So for each of the priority areas that were identified, we reached out to backbone organizations that were already doing this work and asked them to, invited them to join the collective. And so much of the latter part of last year was spent really partnership development and reaching out to those who were working in these various priority areas. And then working together to identify goals and objectives and implementation activities, and identifying who would be responsible for those. So it's really a collective effort of building out these plans. And so for the intersection of health and economic mobility, we really want to focus on increasing overall wealth and reducing the cost of housing and housing related resources, because we learned that housing was a big issue in both the city and county. We want to work to increase employment and education opportunities, to improve wages and reduce those barriers. So that's really our big focus for intersection of health and economic mobility. Around chronic disease, we want to increase healthy food availability, acceptability, and we really want to work on the food system, from working with local farmers to also identifying those food assistant programs and really building those up, from SNAP to WIC to school meals. We're also looking at trying to bring back Double Up Bucks to the region. If you're not familiar with that program comes from the USDA, and it helps to supplement local food sources. So produce from local farmers, it doubles your amount. So if you spend $20, you actually get $40 to spend. So we're working on trying to increase those food assistant programs. We want to work with healthcare for prevention management. So in the healthcare setting, ensuring that food security screenings are being done and that patients are being referred. There are several projects going on around healthy food prescription, where patients with chronic diseases, primarily heart disease and diabetes, are given a food prescription and a voucher for healthy produce to be utilized at some of our wonderful, I'm not sure if you're aware of Metro Market, but it's a bus that utilizes locally grown produce that goes around to our under-resourced areas and sells them produce at a really phenomenally low prices, and it's good food. So, and then helping to build up food pantries and just ensuring that our food system is meeting the needs of our residents. And then around maternal and child health, we want to address those racial disparities to reduce the morbidity and mortality and to improve maternal and infant health. Violence prevention, we're looking at reducing the non-fatal shooting incidents by 25% through increased coordination of community level response and implementation of prevention practices and increased community engagement. And then behavioral health, we're looking at improving behavioral health and wellness, again, through availability, accessibility, and affordability of integrated and consistent coordinated patient-centered care for our vulnerable populations, looking to improve education and community navigation. So being able to kind of a one-stop shop, when you're seeing one provider, they're able to link you to other services, whether that be access to food, access to housing, any of those kind of wraparound services that someone might need to help improve their health. And then looking at kind of integrating those system at a system level. So a lot of this work is kind of looking at our different systems that are around public health and looking to build those up. And then one of the ways that you might utilize our community health assessment is looking at this data and using it for grants, using it to inform and improve health education opportunities, using it to increase collaborative efforts with partners and community members. It helps as a basis for decision making. And then it helps to inform strategic planning of our health departments and other partners throughout the region. And so I will tell you, you are our first group. We actually just kind of adopted and finalized our community health improvement plan last week. And so we haven't had kind of our big splash presser reach out yet, but some of the areas where you might find our community health needs assessment, and as of this morning, it wasn't quite posted yet, but we have it both on our city and county websites. And then we have a regional platform called Think Health STL. It's a data dashboard where we not only post our regional efforts, both the community health needs assessment and community health improvement plan, but other regional efforts. But it's also a great place to be able to access data and timely data to find best practice interventions, promising practice interventions. So in the past, when students would often reach out to us with their projects needing data and information, and partners, if they are putting together a grant, now we can refer them to this wonderful data dashboard. And then we, just like I'm here today talking with all of you, we're going to be going out and talking with different boards and other entities. We'll soon be having a media release, and we'll be working on this plan as we move forward. The Community Health Improvement Plan, this plan is a living, breathing document. So we have our set goals and activities, but as we move along through implementation and as we learn more, we may need to shift our plans so that the plan is responsive to the needs of our residents. Things can come along and happen that interrupt our plan, or that we need to make hard, direct shifts. And so the plan is designed to be responsive to the community in that way. And that's all I have. Let's see here. I wanted to open it up for questions. Bear with me while I figure out how to get back here from my presentation.
Perfect.
There I am.
Gina, thank you so much. That was very informative. And I was not real sure a month ago if, if CHIPS would be ready, if the report would be ready to roll out. So we feel very fortunate to have this hot off the press presentation. And my question, and then I certainly want to open it up for others as well, but can we look at this data through a filter that is more age specific? So can we look at some of the data that's been collected, and how would it directly relate to individuals that are older adults in our community? Can we slice and dice, in other words?
Yes, most definitely. And so one of those cross-cutting themes that we had was looking at these priorities across the lifespan. So I will tell you, as I just said, we just adopted the plan last week. In fact, this afternoon, we have a meeting with our action team leads, those who are leading these efforts, to discuss implementation and how all of that looks. And so definitely in the area of food insecurity, that's an area where we're looking at the impact of that on other populations. In particular, what's relevant to this group, the senior population, in terms of food insecurity. Another area that we have talked about as well, and that it impacts in a different way, is violence. So how does violence, or even the perception of violence, impact the senior population? And when I say the perception, if they're concerned about violence and this is keeping them from, accessing services or leaving their home, so how is that impacting other populations? And so we've kind of just begun on our journey, and as we dig in, and some of this too is who comes along with us on this journey. So this is not something that city and county health departments do alone. We do this in partnership with other agencies. And so as we identify other partners who have other efforts that can contribute to this, these buckets of priorities, we invite them to come along.
Thank you. Other questions from commissioners?
Could you give us an idea, when you mention partnerships, who these partners are? I kind of think I assume I know, but there might be people that I'm not aware of, or groups I'm not aware of.
Absolutely. So leading our maternal child health efforts, we have Generate Health is the backbone agency for that. And then one of the areas that we've identified is congenital syphilis. And so we have Dr. Hillary Reno, who is one of our physicians, and then Dr. Elizabeth Daniels, that are also co-chairing that effort. Around behavioral health, we have BHN, the Behavioral Health Network, is the backbone agency for that, and they are helping to lead that effort. We are currently looking for another agency to co-chair, because we always like to have kind of two backbone agencies that are leading this effort. So we're still looking for a partner there. Around health and economic mobility, WashU is leading that effort. Dr. Tim McBride is currently the co-chair for that effort. The violence, around violence, we have the VPC, the Violence Prevention Commission. That's Serena Muhammad is leading that effort. And then I'm forgetting the food insecurity, the chronic disease piece. We have a group that is called the Food Policy Commission, and that's a variety of partners, and that is chaired by Rochelle Bartnick from the Heart Association and Lauren Lanford from SIU, from SLU. And that group has actually been meeting, some of these groups have been meeting for a long time. I mentioned that this is our second regional iteration. And so both the maternal child health, behavioral health, and the food insecurity groups have been functioning since that first iteration in 2018. Jamie, I see your hand up.
Yeah, thank you. Thanks. I know this is a lot of work and you're doing a great job. Thank you for sharing this with us. I'm excited to say that I sit on a committee through the Trust for America's Health that is working on age-friendly public health systems. And I was excited to find out last week in a meeting that Missouri has been chosen as one of, I think it's 8 states now, that are working on age-friendly public health systems, focused in on CHAS and CHIPS. And the grant award was given to the Missouri Center for Public Health Excellence, which Spring Schmidt leads. And I was wondering if that organization was one of your partners to help bring in the pieces I think that this group is very much interested in, because we know all of the issues other than maternal and child health. You know, we at the Senior Fund are seeing a lot of issues with people not being able to afford their rents. We've been getting calls of people, older adults, the increase in older adults who are unhoused. We have started with the Missouri Foundation for Health funding an Aging and Behavioral Health Council that's been working for the last 2 years in the city and county. And we're finding there's a lot of barriers for older adults to be able to get access to behavioral health services. And we saw during the pandemic, the real issue with food insecurity and older adults that have diabetes and heart disease getting access to healthy foods, because the food commodity boxes are canned goods and they're very high in salt and so forth. And so anyway, I think all of these issues touch on our population. So I was really glad to hear, you know, Carol ask about the data to really look at it, you know, looking at these issues, how are older adults being impacted as well? So I guess my question to you is, is the Missouri Center for Public Health Excellence part of the group that's working on this?
They are not, but I think they need to be hearing this, and because as you saw through each of the priority areas, and the economic mobility one is new, so we're still trying to figure that out. But we really have an approach of working at the system level. Do you know, Jamie, when were they funded? When did that funding
I think
come
they
through?
just were funded. It's a
Just
new,
were funded.
yes.
Okay.
And so I can forward you on to Sarah Crossley, who I think you know.
Oh yeah, I know both Sarah and Spring, so that would be great. And definitely Spring is very familiar with this process and the chip. She actually helped to lead the last round, so that would be fantastic. And I will tell you too, this is a collective effort that we move through without a lot of funding. So when there is a funding opportunity, we direct our efforts towards that. So that would be fantastic, Jamie.
They're
Thank you.
also, Gina, they're also connected with the, I don't know if you're familiar, but the Missouri is undergoing a master plan on aging. And they are part of a subcommittee that's focused on the whole person, that's focused on health. And the master plan on aging is coming out of the Missouri Department of Health and Senior Services. And so this would be and I know that they're trying to tie into their state SHIP, which is the equivalent at the state level. So you know, what we're trying to do is get out of our silos with assessments and share data and share resources.
Absolutely. Jamie, do you know who is leading that at DHSS for the master planning?
Yeah, I can email you her contact information, Mindy Alstead.
Oh, okay.
Thank you. Are there any other questions?
Yes.
Wayne?
Gina, thank you for presentation. It's just a massive amount of information.
It
And
is.
I'm kind of overwhelmed right now. And I want to be sure that we, and I know there's a kickoff coming off soon, but that we have access to this data. And is it this data dashboard that you mentioned? Or is there an avenue that we can make sure that we're connected to access this data both now and on an ongoing basis?
Yes. Let me see. I'm trying to put it in the chat here. So we put all of our information. Oh, there. I put the link to the Think Health dashboard. And then I can also share this presentation with the group.
That would be great.
So that you have it. I'm not sure that this is up yet because, as I mentioned, we have just been finalizing that, and it's, you know, working with both leaderships to get that finalized, it can take a bit.
Challenge.
It's a challenge, but I'm not sure it's up there yet. Our CHA, the assessment, is already up on the dashboard.
Okay.
And then the dashboard is a wealth of other information that you're able to look through and pull regional data as well.
Okay. As long as we have access to it, and that would be wonderful. That would be so helpful.
Great. So Dan,
And I'm also happy to, I'm excited about the opportunities that Jamie mentioned. And so, as we roll along, we'd be happy to come back and present out on our progress and kind of where things are. Because we love sharing this information, because when we go around and share with groups like this, just like what Jamie brought forth, we hope to find little nuggets of other opportunities that we can lean into to help to bolster this work.
well, Dan
Beautiful.
had a question, and I question if it's related to the whole housing issue, which we're going to speak on next. Dan, you're on mute.
No, it's kind of piggybacking off of everyone else's questions, and I'm wondering about the logistics of, since we're a commission that helps give guidance to the county council on older adult issues, we're often asked a lot of questions, and it's very useful to us to be able to rely on data. But the logistics part is my question. How do we access, or what is the best way to hone in on the specific data points that are related to our purview? So you have a massive amount of information, but I assume it's going to be a lot of work to digest it and to then analyze it for specific demographics. And we're focused on 65 plus demographic. And as Jamie mentioned, practically everything that you've studied does relate to us, except for new births. But how can we analyze the impact on our focus?
So I would say that Think Health is probably one of the ways, because you're able to, and let me see if I can share screen and do a little just demo here real quick.
Got it. I opened it on my screen.
See if this works here. Can you see the data dashboard here?
Yeah.
Yes.
Okay.
There it is, right.
So if we're looking for an indicator, let's see here.
Age adjusted.
See heart. Oops.
One point I would like to kind of make is that I do think that the older population is directly related to the maternal health and mortality, because so many older adults are taking care of grandchildren, and so they need to know about the safe practices, and it's all related.
Absolutely, Liz. I was thinking the same thing. We have a lot of grandparents and even great grandparents who are once again finding themselves, raising children. So I just put in housing, since you had mentioned housing was something that you were going to be talking about. So we can look at 65-year-olds living alone, and then when you click on different data, now some data is actually available at the census tract level, or is available at the county or zip code level. So we can look at, oh no. Oh, okay, here we go. So we can look at different, whether it's St. Louis City or the county. It'll tell you the source. And different needs. But if we, and then let's see, let's look at the zip code area here. Okay, and then we can look by zip code
Okay.
at the different percentage around older adults who are living alone. So that's
Gotcha.
just one of the ways.
Yeah,
And
I just
then
typed in 65 plus and I got all these indicators, economic,
Yeah.
poverty, oral health. All sorts. That's interesting. Thank you.
and
I
so that
also-
is one source. And then I will say too, you know, and data requests can be made from we have epidemiologists at the health department who can, in fact, if you see an indicator that has the census tract level, that's been disaggregated a lot of times by our epis and put up there. So our epidemiologists, you know, if you have some specific indicators that you're wanting disaggregated by age, or even a specific zip code, you can make that ask to our epidemiologists as well.
Gina, can we ask of you can you forward us who we would need to reach out to for
Sure,
that?
the process,
And-
absolutely.
That would be very helpful. I hate to cut us off, but we have a really full agenda.
No
and
problem. I
and I-
appreciate you inviting me here today.
This was very informative, and we will definitely invite you back because we would like to have you again and maybe parse some of that data specific to the population that we're working with. I also think, you know, keep in mind that, you know, our role is really to serve as informers to the county council and the county executive. And so having this relationship with the Department of Public Health is just really important for us as well. And I think this was beneficial to our group. So thank you so much. And we appreciated the very informative presentation. If you can forward that to Susan, and we'll get it out to everybody along with the link to the website.
Absolutely. And I just thank you so much. And I thank you all for the work that you do. It's really important work. And so thank you and have
Thank
a
you.
wonderful day.
Thank
You
you.
too, Gina.
Happy
Thanks.
holidays.
Great. Well, that was just super informative and helpful and cutting edge data. But I am going to shift very quickly over to St. Louis County Home Improvement Programs was on the agenda last month, and we had a very good presentation by John Sullivan, and this built on a presentation that we had at a prior meeting from Todd Swanstrom from UMSL, really talking about the issues specifically of home repair, home modification, this as a possible barrier to individuals being able to age in place in their community. This is Dan's wheelhouse, so I am going to turn it over to him because I think what we really want to talk about is what do we do with all this information that we have collected? So as a commission, what do we want to see potentially move forward? So Dan, take it away.
Well, thanks. At my confirmation hearing last month, I was asked the question that I think everybody who's being reconfirmed or confirmed is asked, which is what do you think your focus should be, or what do you see as the number one issue that we should be dealing with? And I followed on Lisa Knowles' confirmation hearing, and I think she answered in the similar way, which is home repair. I just said, and I'd mentioned, and it gave me an opportunity to talk about Todd Swanstrom's study and his work for the city of St. Louis. And I advocated for getting a similar study for St. Louis County, which Todd told us would cost about $60,000 to do, to do the same level analysis to determine, what the average and median home repair costs might be and the age of homes in St. Louis County. And I got a lot of positive feedback when I suggested that. Some of the council members that have been working hard on the whole property tax issue and its impact on older adults also understand that home repair is another barrier to them being able to stay in their homes. So I think we need to figure out a way to reinforce this ask. At a minimum, step one, I think, is to get the study done at the county level. And once we have the data generated for the need, then we can make more specific asks. And there are lots of priorities that were laid out in Todd's report that we were all given. An example of that is, it's great if you have money associated with home repairs, but if you don't have home repair contractors who are available to do the work, you can't really do anything. So training people to do this sort of work is essential in this pipeline to get homes repaired. And it's not just, there are issues like your mechanical system goes out. That means you have no air conditioning in the summertime, which could kill you, or no heat in the wintertime, which could kill you. But also just the accessibility issues that we deal with in our discussions about universal design. Do you need grab bars in your house? Do you need a ramp to get in your front door? Those sorts of things. So it's all related. And I think it's on their radar now, but we have to figure out a way to reinforce it. You're on mute, or I think.
About that. Commissioners, do you have any questions for Dan? Thoughts on this topic? I will say I think it fits nicely with the first priority that we just heard about. When we have these barriers to housing and remaining in your home, in the community, and I think an aha moment from the two presentations that we have had to the commission, in both instances, it is not always paying for it. It's we can't find a contractor to do it. And that's a real issue. So that gets to Dan's point that I think is quite relevant, and that is what can we do about the training component, the workforce issue. So Jamie, you had a question?
I was just going to make a comment. I think that the issue, one of the data points, indicators that Gina had talked about was, I don't know if you noticed, but Age Adjusted was looking at people who spend more than 30% of their income on just basic necessities. And that was part of the original needs assessment that the St. Louis County Planning did to start this commission and to start the age-friendly plan back in 2010, was the Elder Economic Index. And so I would highly look at those zip codes where you have a large percentage of people that don't have the income to be able to make those basic home repairs.
And Carol, I would also mention that, we did make contact with John Posey at East West Gateway, and John thought this made a lot of sense, what we're proposing to do, and they will be getting data coming in January, and he's going to do a lot of research on all of these items that we're talking about, access and training and whatever. So that'll help us see our way, I think. So that's possible.
One of the things that I was going to just kind of bring up, because it's somewhat related, but it's not, and I told Carol about it, sent her a text on this, but a day before yesterday, I attended a summit on broadband, and there is money to connect the entire state of Missouri to broadband. And that is going to directly identify homes that will need this. So I don't know how that's going to help in I don't know how that is exactly going to work, but I think that that leaping into broadband, which one of the big discussion points was about the fact that during the pandemic, the recognition was that it wasn't just about a hotspot or, these little Band-Aids. And this is what Lisa Knoll has said so much about was, how frustrating it was to kind of get people just enough, but not enough to have full access to broadband. So that's going to have a huge impact of that connectivity to everything from contractors to employment opportunities. They were saying there's so much retraining that needs to be done, and people who are looking to retrain to be able to get into these jobs can't get there because they don't have the internet connection to apply for the jobs. So just thought I'd throw that out there as another effort that's going around that is funded. I don't know how it works exactly, but we'll see.
Thank you, Liz. I think it's quite relevant to the conversation.
Yes, thank you.
All these seem to be a bit interrelated. Wayne, it might be a good idea for us to think about, what data John Posey will be looking at in January, and is that something we want to follow up with going forward?
Absolutely.
So, other questions, Dan?
Well, how do we want to proceed on this? I mean, are there specific tasks that we should be, delegating or asking? I'll do some, but depending on what it is, should we be contacting our council representatives in our districts to unify this message? Uniformly say that we all think this is important and we'd like that on their radar. I think it's going to take more than one time mentioning this before, anyone realizes this is a serious issue that we need to deal with.
At our January meeting, I think I hope we will have more of an opportunity to really look at what are those priorities going forward. What do we want to make our real key issues we're focusing on for 2024? And certainly, I think that there's consensus that this is one of them. And then really kind of craft, what would that ask look like? And Dan, maybe you can assist us with that as well.
Okay.
Lisa, do you have any insight? Has Silverhair made this an issue that they're focusing on at the state level, do you know, or just tossing it out to you?
Yeah, that it is not one of their 5 priority items. However, I will say this, that the area agencies on aging statewide have finally been able to access a funding stream of general revenue at the state level, the Senior Services Growth and Development Fund that we've been advocating for some time. So a large chunk of that money is coming to Aging Ahead. And we have had a lot of requests from both elected officials and other community organizations to get access to that money. And one of the things that we really want to commit to is having a very, substantial chunk of that go to home repair, because we haven't been able to do that in the past. So, but the conundrum that we're in is that we have so many people now, organizations, again, elected officials, saying, okay, what are you going to do with these new funds that you have? And we want access to them and so on. So the studies, the data, that's all going to be really important, because we want to be able to prioritize how we're spending those GR dollars and be able to say to elected officials, this is why we're doing that. This is not random. And there's a lot of things we have to backfill in terms of increased wages and food costs and all of those kinds of things that people don't really often think about. But we're really committed to home repair and, but any data that we can get, and it might be persuasive, at the county council level, if they knew that there were, organizations out there that would fund this, be able to fund this if we had the data that, could support us.
So
Absolutely.
to follow on that, I would ask Jamie a question. Since the city has such a report, has it been helpful? And in what ways?
Since the city has such a report on, you mean the work that we
The
did?
home repair that
Yeah.
Todd Swanstrom's team did.
Oh, no, it's extremely helpful, because it shows the gap, the huge need. I mean, when you need millions upon millions of dollars to be able to just, scratch the surface, it's finally showing what the unmet need is from a financial perspective too.
Does it show access to services like training and capable construction employees, et cetera, or anything like
He
that?
does,
It
he
really
mentions he mentions some avenues to pursue, but he really highlights the need for the training. And,
Yeah.
that that's a gap right now.
It's a gap, clearly, city and county, okay.
But it's good in the fact that, so that's another example of how the report is helpful. So that's workforce development. So that would tie into your city county CHIP, because believe me, I've been on all these calls with these planning committees for the county and city CHIPs. And unless you have a majority of people in the room when they're identifying the priorities that they want to work on, that are advocates for older adults, you're not going to be included in the plan. And so this is another way to get into the plan, is to find funding, number one, to be able to implement. And just the fact that this other group has this national funding for an age-friendly public health system is huge. And if you could start using to focus on home repair as maybe your focus area, I think would be a real good asset.
Jamie, do you advise, so how do we engage with this new initiative?
I think it would be really great if they could come and present to you. And the next time and I'm going to connect Gina with them. One of the women used to work at the health department. Two of the women used to work at the health department. I'm trying to find out a little bit more about, now this is a statewide initiative. The funding is statewide, but St. Louis County is 20% of the population of the state. So it's significant. And I told them about you as well, and the age-friendly, plan that you all are oversee. And so they're very interested in learning about you as well.
Yeah, if we could maybe connect offline a little bit further about that, to see about digging a little deeper into that relationship and garnering more information from them.
Sure.
I really do see this issue very similar to the whole universal design issue, in that it touches so many people. It's not age specific. The fact that home repairs not only could help you stay in your home longer, help you live more safely, improve your health, it also helps the neighborhood. It helps stabilize financially your community. I mean, there's so many interrelated topics that are affected by it. And then workforce growth and job creation.
Right.
It touches so many areas that I think you could get a lot of support.
And again, I'm in total agreement with you. And I'm again bringing up the topic of broadband. I know that the city has allocated $5 million to getting broadband to everybody. And that's going to be, and at the meeting I was in yesterday, you have AT&T, Verizon, and Worldwide Technologies right there working on all of that. So getting into these homes to provide this broadband is going to, identify all these other things and give people tools to be able to access things such as home repair. So I think
if you're assessing the deficiencies in one's home, broadband is definitely a component of it.
Exactly. Well, that's what one of the points they brought up at the meeting was there was a focus group that had looked into it, and they specifically talked about older adults, by the way, which was interesting. But they just said food deserts and broadband deserts are one and the same. So you
Liz,
address
we're-
one.
I was just going to say we're fortunate to have you at the table representing older adults, because I think that it's not necessarily a top of mind segment of the population that we think about in terms of broadband. So we're fortunate to have you there. So I think we can continue this conversation in a whole lot more depth at our next meeting, because it certainly is an identifiable area of focus that I think we want to hone in on and make it a true priority. And we appreciate the work that Dan is doing on this, and also serves on the master plan on aging, dealing with all these issues related to housing. So, not only are we thinking about it locally in terms of our county, but also on a statewide basis. So thank you very much. I am going to ask if we could shift. Lisa Knoll needs to get off a little bit early today. So I was going to see if we could just shift and let her go ahead with the Aging Ahead update. And then we'll come back, Liz, to financial protection, if that's okay. So Lisa.
Thanks, Carol. I appreciate that. And I hate to have to exit early, just I have a doctor's appointment. So a couple of things. So we wanted to talk about the master plan on aging listening session. And first of all, thank you, Liz, for helping me sort of track down a location. I think where we landed, at least for now, and it's actually going to be published soon. So we looked at the Danforth, Liz looked into Danforth Center, and but I think we're going to end up at Maryland Heights Community Center. So I think that was another suggestion at the last meeting that we had here. That was somewhat central. And so that again is at 9 o'clock on March the 5th. And we are asking that, and this, we just had this conversation, the AAA directors yesterday, we're asking the organizers, and that's Mindy Olstad and the contracted folks that she's working with on the plan, to allow us about 10 minutes at the beginning of that listening session. So not only just to talk about, aging ahead, but also what other things are happening aging wise in our area. And so, any of you that want to participate in that, to just give some, a little bit of background. But then I'd like to see us also recognize some elected officials that we're planning to invite. So kind of just keep that in mind. So we'll have 10 or 15 minutes where we can, say whatever we want to, basically, and do some of those thank yous to, our local folks that are attending. And then I also wanted to give, a couple things. University City, we're still working on that. Wayne and I have been going back and forth. We've got a couple of several irons in the fire for University City. As you recall, I have been talking about us having to close that center some time ago. And it's definitely an underserved area. There's a lot of need there. And we really want to get back to a full-time senior center type program there. And are looking for space and partners that can help us move that forward. So very actively working on that. And thank you, Wayne, for your help on that. Then quick update on GrandPads. This is kind of exciting. So we had our very first, I think it was last week, maybe, we had our very first virtual kind of get together with all these 750 people invited that are on the GrandPad program. I think we had almost 200 people, if you can believe that, on a Zoom. And these are all older adults with the GrandPads, various levels of, technology, aptitude or whatnot. And then we broke out into, focus groups or forgetting what I'm trying to say. What am I, when you break out into groups on a Zoom?
Chat rooms.
Chat rooms.
Thank you. Thank you. Yeah. And so everybody was able to do that, which was kind of fun and interesting. And then so we got into smaller groups and just sort of talked about, what kind of programming they like on the GrandPads and, how they're using them. And it was just, they were very engaged and it was a lot of fun. And we're going to do that in addition to the regular programming that's happening. We're going to do those group meetups regularly, like maybe once a week or something. So, and then these folks they're getting the meals as well, which so far so good. Everybody, it's from Mom's Meals, if you're not familiar. Dan, do you have a question?
I do. When you're talking about the chat rooms and you're talking about the GrandPads, I was wondering if the listening session could have a virtual component and people could somehow connect. I'm very rarely an advocate of a hybrid meeting, but
Yeah.
this is an instance where people might not be able to get to the meeting. Is it possible to have people connect virtually?
There's a level of technology that's needed at the site, and I'm not familiar if we did it at our office, we could do it. So I think it's a great idea. That's just my opinion. And I will see what we can find out from Maryland Heights, from the city, what kind of setup they have. I would imagine because it's a newer facility.
It's a new
They've
building.
they likely have some technology that would be helpful. So
As we know,
Yeah,
the
that's
experience of
great
being
idea.
remote isn't always that great in these calls, but
Lisa,
So,
one of the things I
ahead.
was just going to say was that the GrandPads were, that program has really, really been a great highlighter of the importance of what happens when you do engage the older adults. So it has been so helpful to use that information and the data in the library system as a model for how beneficial it is. So
Yeah, and so that's a good segue. So let me tell you the really exciting news is that there was a WashU research group that worked with the library and GrandPad and did some surveying and things. They and this is all I know being recorded, but this is all between our group because it's not finalized. But they have applied. They've chosen the GrandPad program in Aging Ahead's Virtual Senior Center. They're applying to NIH for a research grant to look really in depth at the social determinants and what this program is going to do for quality of life and the whole issue of isolation and other determinants. So that is huge. It's a 4-year research project. And they, as a result of that, GrandPad is very engaged in, how can we collectively make, the technology even better. And so, because there's some limitations, understandably, but so just it's going to be a really cool collective effort to really both dig down and see how these things really are helping folks. But then when we talk about expansion, we can really hang our hat on some things that the research is going to be able to show us. So it's really great. And so
Very
stay tuned.
exciting.
Lisa, that's great. And by the way, at the meeting yesterday, I connected to not only, Representative Riggs, who's doing this, statewide as far as broadband, but also with United Technologies, Verizon, and AT&T, and with Sam Page's office, that are all, hats off to you for all of this, because
Right.
it was such a struggle to get the GrandPad to make the transition to having it under you. And it's just so great because it's such a fantastic
Thank
tool.
you. Yeah, and knock on wood, so at all levels, it's just, moving leaps and bounds. So to be on that call with all those people, and I was in a breakout room with probably 6 people, and 2 of them were bedbound, and they were on their GrandPad. and they were so excited. And I mean, the whole, it's just so, we got off the call and 5 of us from our office sort of converged in the middle of our office, and we're just like, this is like the coolest thing we just experienced. And so anyway, and the folks from WashU were on that call. They got to see that too. And then the folks from GrandPad. So anyway, we want to try to put that in a bottle somehow, right? And talk about, all the good things that are happening. So WashU research group is going to help us do that.
Super,
That's awesome.
super.
That gives me goosebumps. I just have to tell you.
Right? I know.
It's
I
just
know.
so cool, Lisa.
And
It all started right here, that's what's really great is it all started right here and was supported here and moved forward here. So
Yeah, thanks to the library. Thanks
Thank you,
to
thank you.
Liz for her persistence.
yeah, listen.
Yeah,
both
it was a collective effort, and
Totally.
yeah. So thank you. Anything else from?
thanks, everybody. I am going to have to log off, but I appreciate that. And I will keep you up to date on anything new happening with those listening sessions. But Dan, I appreciate your suggestion, and I will ask them about trying to get that to happen.
And Lisa, I think we want to invite members of the county council. So probably that's something we can put on the January agenda, because if we invite them now for March, it may be lost in the holiday fray. So we can talk about that. But I think it's a good idea for them to be present, or at least be invited to be present.
I agree. And then we'll have state elected officials from our area as well.
Great, great.
Okay. All right. Thanks, everybody.
Thanks, Lisa.
Thanks,
Happy
Lisa.
holiday.
That's terrific. That's exciting. So Liz, you want to give us an update on some of the work you're doing with Elder Financial Protection Coalition and those activities?
Sure. We're working on, really, we're still kind of not sure if there's what the meeting's going to be like in the beginning of next year. There is a big meeting that is going to be going on financial protection in Kansas City that we are going to try to have the same program, which as always is kind of done by Catherine Vanier here in St. Louis. So increasing the awareness. I sent out there was a kind of there's something on the county website about scams that is being circulated. So I think we're improving on that. This broadband effort is going to go hand in hand with financial protection, because the big concern of the broadband is how to protect these older adults from the scams. And so that's part of, and I'm on I think it's a quarterly meeting on the broadband, so that's all hand in hand. So
Great.
Jamie, do you know of any other efforts going on the financial protection? I don't think so.
No, not, I do know that the Missouri Council on Aging is trying to elevate, so the Missouri Council on Aging, if you're not aware, is focused on older adults and people with disabilities, and trying to elevate. What we found is that people are advocating for issues, but they're advocating for issues in silos. And so the role of the Missouri Council on Aging is to educate people on all the different things that are going on, and how we can raise awareness not only to us providers about what all is going on, but also to the legislators. And I will say that because of term limits, many of them are unfamiliar with so many things that are happening. But to answer your question, Liz, that's I haven't heard of anything else.
Okay,
But we
no.
also elevated.
Yeah, so we'll be meeting, I think it's January 14th, as a group. So that's about all, but it is closely connected with the broadband effort.
Also, somewhat along the lines of financial protection, is the circuit breaker piece of
Yep.
legislation that we have endorsed as a commission. And 2 bills have been filed, pre-filed, which is a really good thing because that means it's hopefully going to get an early hearing and not be halfway through the session before a committee takes it up. So Matheson, representative from O'Fallon, has filed House Bill 1670, and Tracy McCreary, who I think many of you know from the St. Louis County region, has filed Senate Bill 822. And we have talked about kind of what that does in a nutshell. It increases the income limit for both renters as well as homeowners to qualify, and it also changes some of the language in relationship to how much money you can receive as a credit, because previously, as you move toward the income cap, you were receiving just a pittance in terms of what you got back. So people were saying, yeah, I went through all this and I got $12. So that is being changed as well. And I believe there's a COLA provision. So I can send out a copy of the Senate bill. I think they're going to be pretty much companion bills if people want to take a look at that. And if you don't, delete it from your inbox. But any questions along those lines as we move into the session, that'll again become important. So we'll keep you apprised. So thank you, Liz. Next is Universal Design, and Dan.
So at the county level, really not much has happened. I hadn't heard any new information. I did reach out to my council representative and I did not get a response. So I think we're just waiting to be invited to the next meeting when it occurs. On the state level, however, a lot has happened. The subcommittee on universal design for the master plan on aging submitted its recommendations to the larger group in November, and the larger group and those overseeing it came up with the final recommendations that we've gotten back, and I was very gratified to see that our recommendations have been incorporated in it. And what's really interesting about the overall master plan for the aging in place and housing subcommittee is that so many of the different areas of concern overlap. So, we were advocating for certain things from a universal design perspective, and one of those things was increased funding for MHTC to build more low-income housing tax credit projects. And our reasoning is that low-income housing tax credit projects are already designed and constructed under universal design principles. That's part of the MHTC mandate. So from our perspective, the more LIHTC projects you get, the more universally designed apartment units you get. From the affordable housing subcommittee group, they were also advocating for increased funding for low-income housing tax credits because it provided more subsidized housing for people in need. So in the same way that our discussion on home repairs shows that there are low overlapping advocacy groups, the same thing is occurring at the state level. I thought that was pretty exciting.
Super, yeah.
That's terrific. And it's really nice to see this going on at the state level and the kind of intense interest in this area.
And I think, Jamie, you probably were one of the people reviewing all the parts and pieces.
Very much so. So anything else, any questions on universal design? If not, I'm going to shift to new business, and just want to mention, did someone have a comment? I want to make sure I'm not cutting anyone off. we will be working on the report to the county executive and the county council after the first of the year. I know we have a number of new members, some of whom are not with us today, but this is a report that is written by the commission every year. And we submit this to both Dr. Page as well as members of the county council. And then we do a follow-up presentation, which kind of takes highlights from the report and puts it into a PowerPoint. And we do that for the county council. It's a presentation we do in May to committee of the whole. Last year, we were somewhat disappointed because the attendees from committee of the whole that actually came to that presentation were few. And so this year, I think we want to do a much better job of outreach in advance to encourage them to come and have dialogue with us about both what our accomplishments are, because that's a big part of the plan, and what are our priorities going forward, which I think, we've talked about already thus far in the meeting. So we'll be doing more of that after the first of the year, but I wanted to kind of put it on people's radar screens. If anybody needs a copy of an older report, I'm happy to send you a copy or a copy of the PowerPoint. The PowerPoint's a little briefer and a little clearer because it's not quite as long. And Susan does most of the writing of that, but we have input into what that looks like because we really don't have a lot of parameters around what's in the plan. So more to follow. Any questions on that? Just want to put it on your radar screen.
Carol, one thing that I just want to kind of ask everybody is that I have got a meeting with Dr. Page on the 20th of December. And so the point of that was to talk about the benefits of broadband for St. Louis County as far as older adults. But if there is anything else that what you think it would be, anyone here thinks I should incorporate into that conversation, please let me know. I know it's because of all of your work that he wants to meet with me, so.
Good.
Liz,
And we have a request, I have a request in as well to meet with
Okay.
Sam, Dr. Page. And part of that is to, as you know, I am rolling off as chair and Dan is rolling in as chair. And Liz and I met with Dr. Page when we made that transition previously 2 years ago. And I think it was really helpful for the county executive and really brought him up to speed on what we were doing and priorities and let him know who's going to be, at the helm. So we've made that request as well. So I don't know if you may want to fold all those in together. I don't know, Liz. We'll see.
Well, I will certainly underscore the importance of having the chair of this committee, have a relationship with him. Yeah, I will encourage him to meet with you and Dan and say that was so helpful. So.
Yeah, that would be
Liz,
great.
I
And
would
I
ask
had
you to,
suggested after the first of the year, just because the holidays are so chaotic. Dan, go
Absolutely.
ahead.
if you have an opportunity to talk about home repair in conjunction with the broadband issue, I would appreciate that.
I will certainly do that. And the other connection was to Dee, and I can't remember Deanne's last name, but she was, the county executive sort of person who's in charge of kind of our area. So I'm going to also be meeting with her again. So it's good.
And Liz,
Terrific.
if there is anything like in writing or anything on broadband, that would help me understand a little more what it is and its role and function, and just if it's not too much trouble.
I'll be very happy to send to Susan, have her, that it's Connect STL is the over group that is in kind of doing the broadband. And the guy who's in charge there is Simon Wong. He's with Tashira Jones's, with the mayor's office. And I think Dion is kind of the person who's been plugged in to be the equivalent in the county. But
Okay,
so, but I can send you a link to all of that, and there's lots
Okay.
more in there.
would be appreciated. Thank
Liz,
you.
could you send that to me as well? And
Happy to.
I'll get it out with some other things when Susan and I will make sure to coordinate some of the things
Okay.
we've talked about. That'd be terrific.
Carol,
Yeah.
real quick, in this report that you all are putting together, I would highly recommend using the data that we received from the Missouri Budget Project on how home and community-based services at the state level has been cut by 40%. And so more and more responsibility for services, for home and community-based services for older adults and people with disabilities is landing on local communities. And in addition to that, you know, we saw articles in the Post where research has been looked at with the county Department of Human Services, where most of the older adult programming comes from, that their budget has been cut in half over the last several years. And so taking those data points to say, you know, you all are asking for money when there's just not money available. And I think, you know, I would recommend maybe looking at some of those data points to add to your report.
Jamie, could you send me that? I would be very interested in it.
Absolutely.
Great. I think that's an important issue, certainly for the people in our county. And yeah, let's take a look at that as well. So I wanted to take a few minutes. We have gone back and forth with, do we WebEx? Do we meet in person? Do we do a hybrid? I think we had a couple of meetings in person at the transportation offices on Lindbergh, and the first one went fairly well. The second one, we had huge technological issues where anyone who called in, we could not hear them, et cetera, et cetera. So it was an issue. But we've also had requests from members of the commission who've said, you know, it really is nice to be able to meet in person, and we get a lot done, and it's sometimes a better working environment. So I'm tossing it out to the group. I think I proposed, you know, do we want to do primarily WebEx, but would we consider, you know, maybe meeting quarterly, maybe 3 times a year? We take off during the summer in person, but this is a group decision. Any thoughts? And I know a lot of people aren't here today. Dan.
I'm very supportive of that idea. I particularly have a challenge getting, you know, meeting in person, I think is great. It adds about an hour to my morning. So I do like the convenience of the virtual meetings. I also prefer all virtual rather than the hybrid meetings for the very reason that you mentioned, the technological problems that we've been having. But I think a good compromise is to have 3 in person to person, you know, in face-to-face meetings, and the rest of our meetings virtually.
Are other people in agreement with that?
I agree, you know, minimum 3, maybe if we could do it quarterly, that would be great. But I think certainly we should be meeting in person if we can.
So why don't we look at getting a spring meeting? I think with the weather in January and February, I don't know if we want to put something on the calendar, maybe a March in-person meeting is our first one, and then we'll just continue on with WebEx for January and February. Is that okay with everybody?
Mhm.
Okay.
That sounds
Okay.
good. That sounds good to me. I would like to add one item to that. When we have a presentation, would it be too much to ask for them to give us an outline or something of their presentation? I mean, we got so much data this morning and it's gone now. And so at least access to where we can get it and everything like that. And I would look at it ahead of time if they were willing to do that, just to ask. I just wanted to throw that in, so.
Wayne, I think it's a good point. I mean, we can ask for it in advance. I think with today, it was so hot off the press, there wasn't
Okay,
an advance to be able to share. But we will get you the PowerPoint
Right.
for sure. The other thing is this is recorded. This meeting is recorded. And I need to get with Susan again about how to access where to find this recording, because I don't think it's real intuitive to be able to track down the recordings, but we can get that out as well, because sometimes it's helpful to go back and revisit what was discussed.
great, good. Thank you.
I don't know if you
Okay.
can I don't know if you can see my comments, but Wayne, I just put a link to the information, the data that Gina was talking about for the Community Health Improvement Plan. And I also put a link to that report, Julia, from the State Missouri Budget Project. And Carol.
Okay.
Okay, thank you.
Yeah, I tried to link to the Missouri Budget Project. It's not letting me in, so I'm having problems with that one.
Huh.
I'll send it to you directly.
Thanks.
Can you
Oh,
copy
me
me as
too.
well?
Yeah,
Great.
I'll copy. Yes.
Great.
Yeah, oh, I'm sorry.
What else? Go
Carol,
ahead,
is
Liz.
it possible to get some of the links because I'm not able to get, this is Cookie, I'm sorry. I'm trying to keep up with the links so that I can go back and look and review them. So, and I couldn't make a screen print. I'm new at this, so WebNext said no screen print. So is there a way that you can share those to our emails?
Yes. You know what I think I'm going to do, Cookie? I mean, if Jamie can send me those, and Susan and I will kind of compile, because it's going to be a lot, but and we'll get that out to everybody. So I think it'll be helpful. And also we have a number of members of commissioners who were not able to be with us today. So I think having that information for them as well would be good. And
Thank you so much.
so thank you, Cookie, for bringing that up. And I will find out how to access this, and maybe generic host can help us a little. How do we, get to the place where this is stored as a recorded meeting? Because that will be helpful for those members who aren't able to be in attendance today. So
Yes.
next on the agenda,
Carol,
yeah, Wayne.
just let me confirm. We have now decided that we're going to meet in person 3 times in a year.
Yeah,
Am I clear on that?
that's what we talked about. Yes.
But that is what
Yes.
we're going to do as well.
Yes, that's what we're going to do.
Okay, all right, thank you.
Okay, good. Thanks for clarifying. So leadership transition. This is my last meeting to fully chair. Dan has been vice chair, and our protocol has been that the vice chair is the chair-elect. And so we are honored that Dan has served so well as vice chair and will be moving into that chairperson position. Wayne was the secondary chair, and his life just took a little bit of a detour with the birth of a beautiful granddaughter who is going to
Seems like-
consume a little bit of your time.
Yes, you betcha. Wonderful, wonderful. Enjoying.
So he is stepping down from being the second chair. And so I spoke to Wilma Smiths and asked if that is something she might be interested in. And she graciously had her arm twisted to serve in that capacity. I gave Wilma her very first job, so she says she has a really hard time saying no to me. But that aside, we will be, the protocol is at the next meeting, and I just need to run this by Susan again. We will have a vote, of course, on, on our new leadership team. And then Dan will assume the gavel and take over for the January meeting. So I just wanted to see if anybody had questions in regards to that. If somebody else would like to step up and raise their hand and say, I have an interest. Absolutely. Also, we have not had someone as a note taker, and I know that we had a student for a while, but she is unable to be with us this semester. And that is something I think we need to revisit again, and that is to have someone who can take the notes, because Susan has a lot on her plate in addition to being the note taker and getting minutes together. So if we can support her, so we can bring that up at the next meeting too.
My question is, how do we thank you?
Exactly.
You are so sweet. Just send checks.
Yeah.
No,
Any
Carol,
particular liquor of choice?
no, Carol, you've been great. And thank you.
Well, you guys, this is just such a exciting, this is a great group, and I just so appreciate the collective wisdom and the fact that we come from, different and diverse backgrounds, and work so well together and are really focused on what the mission is and how we can collectively improve making St. Louis County an age-friendly community. And it's sometimes a very heavy lift and sometimes very incremental, but I think we've made some great strides. So thanks, everybody.
And we have been blessed by you and your leadership, and you are why all those things happened. So thank you.
Oh,
Thank you for so
You're great.
ably leading us. It's been fantastic working with you.
Oh, thank you. I'm going to get through the rest of the meeting now.
Well, can I just
I
add
just-
real quick, Carol? Thank you
Yeah.
for, even though I've only been a short time member, 4th District. You just been so classy and so phenomenal with how you handle things. So I'm gonna say this, and no point intended. Whoever follows you got a hard shoe to fill.
Yeah. You said it well, Sharon.
Thanks, Cookie. We are just honored to have you, and your district seat sat open for a while, and I know that Councilwoman Webb was looking for the right person and was thrilled when you were appointed, and you help us by making us aware of services that are needed in the North County area and keeping that on our radar screen. So thank you so much for that. So I want to take a few minutes. St. Louis Senior Fund, Jamie, do you have any update? And do you want to speak to St. Louis County Senior Fund situation?
Sure. So yeah, a group came together, including Carol, and I think Dan, you might have been on the call as well,
Yes.
to talk about whether or not to move forward with trying to get on the ballot a Proposition S again for senior levy fund. I will say at the meeting, our consultants, Michael Kelly and Megan McBride, had talked about the need for polling. We have secured secured funding for the polling. Oh, Jen?
I'm sorry to interrupt. I am just looking at the agenda and wanted to make sure that you weren't discussing anything that wasn't noticed up on your agenda. So if you could tell me, is this the St. Louis Senior Fund? Is this what you're
Yes.
discussing right now?
Yes.
Yes.
This
Make
is
sure.
St. Louis Senior Fund. Jamie is the executive director for St. Louis Senior Fund.
And I apologize. I lost sound for a minute. So
That's okay.
okay,
No problem.
thank you.
No problem.
Yeah.
So I think the decision right now is to wait and to do some polling to see what the voters think of an additional property tax that would focus in on services for older adults. The huge benefit is going to be that we have one in the city, and so we can give concrete examples of how the funds can be used for many of the things that you talked about today. So anyway, that's where we are right now. Is a committee, an executive committee of the steering committee is going to be meeting in December to try to get things started. Chris Beckley, who's the CEO for Cardinal Ritter Senior Services, is taking the lead, and Claire Hundelt from the Daughters of Charity Foundation is helping to facilitate the work because she was the one that actually got this started back to get the city senior fund passed. So that's where we are right now, and there will be more to come.
Great. Thank you.
Thank you.
Thank you, Jamie. Dan?
Yeah, just one item that I think was probably part of the leadership transition topic, which is the District 2 still needs a
Yes.
representative on this commission. That's Kelly Dunaway's district. And so I don't know if anyone can help us.
I've reached out to her. I reached out to her a couple of times. I'll try again.
Thanks, Liz. That would be great. And Dan, thanks for bringing that up. I did have a little note to mention that, and I failed to do so. So good point. Sue isn't here to give a report on Commission on Disabilities update. Do any other commissioners have something they would like to report on? So we have public comment. I guess I'm a commissioner, so maybe it would fall under the commissioners. I just want to welcome Michael Weiss, who has a little square on today. And I also want to thank Paul for being here and taking notes. But Michael is the new director let's see, what is your title? For Division of Family and Community Services. I knew I had it jotted down somewhere.
It's a long one.
Yes. So Michael, welcome. And I would think if you would like to make a comment under public comments, that would be appropriate.
Sure. Yeah. Apologies for not being able to see me. It's been a hot mess of technology here at home, trying to figure out things. The perks of moving from out of state. So, but yeah, no, thanks for allowing our division, my office, to be a part of this. I know Susan usually has been a huge help. She's usually here. Thoughts and prayers to her. She's feeling under the weather. So we have Paul and myself stepping in, but a lot of big, bold ideas are going to be coming from this office. That's one reason they brought me in, being the overly ambitious millennial that I am. We need to bring some new, fresh perspective. And so I will be bringing a vision of simplicity and clarity to the office. And that way we can move through things without as much as I am part of the bureaucracy now, without the bureaucracy involved. So your guys' input, what you're doing is essential. I appreciate each and every one of you and look forward to getting knowing you guys, as well as if there's anything you need, please do not hesitate to reach out to Susan, my office. We will support and help however we can. It takes a village, so let's become that village.
Thank you so much for that. And we appreciate Susan and all she does for us as commissioners and for the commission. She's been terrific to work with, and we just want to make sure that older adults are on your radar screen and the importance of older adults in St. Louis County, and our work to help them help older adults age in place in the community remains top of mind.
I would like
part of our mission.
I would like to add, I like how a lot of this one started with a specified focus on the health factor. Coming from my social work career, starting with youth and families and the traditional, I did spend 6 years in healthcare social work, and I would say 70% of my job was interacting with older adults and learning the challenges that are there for their health. And especially when it came to, like you said, aging in place, too many families, too many persons of certain stakeholder status wanting just, nursing home this, assistant living that. We need to not focusing on the comfort, the peace, the health that comes with being where you are independently as best as you can for as long as you can. And so even my own grandparents, watching them go through those things and watching how they flourished when we were able to do that for them before their passing was essential. So I stand behind you guys. As a younger person, I see the value and importance that our elders have brought and will continue to bring. And I see it as a responsibility as a younger person to return the favor that was given to us by those older folks. So for what it's worth, not to be too sentimental, I do see it, I hear it, and I'm glad to be a part of leading that effort, along with, again, Susan's work and her team. She's doing a fantastic job, and if I can give her a raise, she'll get it, trust me.
Good to hear.
Yeah. Well, thank you for taking the time to be with us today. And Paul, you've been taking notes. Do you have any comments you would like to make? I just am recognizing you. We appreciate your being here in Susan's place.
I'm just glad to be a part of it, just helping Susan out. She asked me to step in for her and take notes, and my hand is cramping a little, but I'm okay.
Well, thank you. We appreciate it. So I think that, and Jen, thank you for being our attorney present in our meeting. It's my understanding that that all committed boards and commissions now have an attorney attending their meetings. So, we want to make sure we're in appropriate compliance. And thank you for being here.
Oh, you're welcome. And
So,
I was filling in for your regularly assigned attorney because he had a conflict today, but he should be back for your next meeting.
great. Super. Thank you. I think that's it. I hope everyone has a wonderful holiday season, and it's going to be over 60 degrees. Get outside today. Enjoy the fresh air, and we will see everyone the first Thursday in January 2024. So, and we'll get out all that information, copious information. Susan and I will try and pull all that together, and great meeting. So thanks, everybody.
Thank you, everyone.
Happy
Have a wonderful
holidays.
holiday.
Happy
You too.
holidays. Santa good to you.